Okay, great. Thank you for having me. Thank you for hosting this conference that is free and to help educate so many people out there. The privilege and honor is mine. And today we'll be talking about one of my favorite topics, which is plant-based diets and kidney disease. And as was stated earlier, I'm a clinical assistant professor at the NYU Grossman School of Medicine. I also work at Bellevue Hospital here in New York City. And why don't we go ahead and get started? So I have a couple of disclosures. I do a little bit of consulting work, and I also eat a plant-based diet, and quite happily at that. So this is the table of contents. So we'll be covering a lot of ground. This is a 1.5 to 2 hour lecture with time for questions at the end. And the basics of it are, we'll be talking about kidney disease and plant-based diets, and then we'll combine the two. And we'll also talk about the causes of kidney disease. We'll talk about the complications of kidney disease. We'll also talk about kidney stones. We'll also talk about risks of plant-based diets in kidney disease. And then finally, I'll bring it home and I'll wrap it up.
Doctor, are you sharing slides just because we don't see them, just in case?
Oh, I am sharing slides. I'm going
to have my tech team jump in case they can help guide you, just in case.
Dr. Joshi, if you want, just hit the share screen again at the bottom of the Zoom window.
Are you able to see my slides now?
No, you'd have to do it from Zoom. You have to re-share your screen. Sorry. So go back into the Zoom window that we have and minimize your PowerPoint.
Okay, just give me 1 second. There we go. All right, what about now?
Great, yep, now hit play from the beginning. Okay.
Okay. All right, how we? Okay.
Great, we see everything now, yeah. And you can also go in presenter view from here if you right-click the screen.
Okay, great.
Yep, you're all set.
Okay, great. Okay, great. Sorry about that. So let me go back to the table of contents here. So this is the table of contents. And why don't we go ahead and get started? So we'll talk a little bit about the basics of kidney disease. And so the kidney is basically a giant filtration organ. It does a lot of other things besides filtration, but you can kind of think of it as a giant filter. It's composed of these components called glomerulus and tubules. And these glomeruli and tubules filter and then absorb and secrete substances to help with sustaining life. Each individual filtering unit is called a nephron, and each kidney has about 1 million nephrons. And you can see blood flows into the kidney through the artery, and then blood comes out. And as blood flows through the kidney, it is filtered in the glomerulus, and then it goes down into the tubules, whatever is filtered at that point, and absorption and secretion takes place to ultimately produce urine. How is kidney disease diagnosed? A blood test is done to measure your creatinine level. The creatinine level is then used in a mathematical equation to calculate your eGFR. And the eGFR determines your level of kidney function or kidney dysfunction. The eGFR stands for the estimated glomerular filtration rate. And that number generally falls into one of 5 categories. And it could be greater than 90, it could be 60 to 90, it could be 30 to 60, or it could be 15 to 30, or finally between 0 and 15. The higher the number for your GFR, the better. And then the lower the number, the worse it is. For those that are in stage 5, they could be on dialysis, or they may not be on dialysis. And this GFR roughly correlates to percent kidney function. So doctors may use it to say you have a 60% kidney function or 75% kidney function. And what they're using to get that number is likely this eGFR number. Chronic kidney disease is unfortunately common. About 15% of US adults are estimated to have chronic kidney disease. That translates to about 30 million people. For those who have diabetes or high blood pressure, this prevalence does increase to 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure. And this is kind of where plant-based diets come in. So plant-based diets can be helpful in treating both diabetes, hypertension, and also kidney disease, which is the subject of this talk. Before we get into that, I wanted to go over a little bit of plant-based diet basics. So what is a plant-based diet? So there is no exact definition, and it doesn't mean you have to be vegan or even vegetarian. Your diet is just mostly plants. And another way to say it is that you are eating less meat and dairy than the standard American diet. And there's a variety of terms that have been used to describe a plant-based diet. Some of these terms include plant dominant, plant strong, plant supportive, plant leaning, plant forward, plant powered, and these are all terms that mean that plants are the focus of the plate. So what is a plant-based diet? Examples of a plant-based diet include a Mediterranean diet, a vegetarian diet, and of course there are several subtypes to a vegetarian diet. It could also include a flexitarian diet, a pescatarian diet, a reducitarian diet, a vegan diet, a DASH diet, and then also a whole food plant-based diet. Plant-based diets can still be unhealthy. So an unhealthy plant-based diet could take the form of French fries or fried potatoes and a burger. A healthy plant-based diet emphasizes the consumption of healthy, unprocessed plant foods like fruits and vegetables. And there's many things you can eat on a plant-based diet. People often think of these diets as being restrictive, but many of the things that you can eat include fruits, vegetables, tubers, whole grains, legumes, nuts, and seeds, and so on and so forth. There are a lot of potential benefits of a plant-based diet in kidney disease. Plant-based diets have the potential to prevent and treat some of the causes of kidney disease, including diabetes, high blood pressure, obesity. They can also help with the complications of kidney disease, which we'll talk about in this lecture, and also help prevent the progression, or at least slow the progression of kidney disease for those who already have it, which we'll also talk about in this lecture as well. And this comes from a recent paper that we published last year for anyone interested. So let's first talk about the causes of kidney disease. The causes of kidney disease are broken down in this pie chart here. And what you can see is that the major cause of kidney disease in blue is diabetes. Diabetes accounts for nearly half of all causes of kidney disease. And high blood pressure comes in second place, accounting for a little bit more than a quarter of cases. And then the last quarter of cases is made up by a medley of various causes that unfortunately occur, but are not necessarily related to diet or lifestyle. So the focus of today's talk is actually on the other 3 quarters, the diabetes and hypertension, and how that relates to kidney disease and what can be done about it. So how can plant-based diets help with preventing and treating diabetes and obesity? I have only one slide on this because the rest of the talk is on kidney disease, and there are other speakers and presentations on this topic. But to briefly summarize, plant-based diets have a lot of fiber that can help with reducing weight gain. They also are low in caloric density. They help reduce caloric intake. They reduce fat intake. And they also reduce processed food and sugar intake when plant-based diets are consumed in a healthy fashion. And similarly, plant-based diets can help with weight loss, improve insulin sensitivity. They can help reduce the glycemic index of foods. And they can also improve insulin secretion. So all these things can help with these 2 diseases that contribute to kidney disease. The other major cause of kidney disease is high blood pressure, as I mentioned earlier. It is is the second most common cause of kidney disease and kidney failure, but it's also a complication. And because it is a cause and complication, I wanted to spend a few slides talking about it. As kidney function declines, sodium excretion becomes impaired, and this causes the body to retain salt and water, which then leads to high blood pressure. And this causes activation of several hormones that raise blood pressure. So a little background on high blood pressure. Unfortunately, high blood pressure is common in this society. 102 million Americans have high blood pressure. And if that's not sad enough, if you don't have high blood pressure at the age of 45, your 40-year risk of developing high blood pressure is still about 90%, depending on ethnicity and gender. It's still very high, which is unfortunate. And this leads some to believe that high blood pressure is destiny or it's natural with aging, but that's not actually true. I give this lecture to our medical students, and in that I describe that in indigenous societies, high blood pressure does not naturally occur. And actually, as we get older, blood pressure stays the same or may even decrease. And ultimately, researchers came up with an idea that perhaps we can modify the rise in blood pressure by the foods that we eat. And this ultimately led to the creation of the DASH diet. And in an obscure paper, the creators of the DASH diet actually wrote their rationale for it. And they write that the diet was designed to have the blood pressure lowering effects of a vegetarian diet, yet contain enough animal products to make them palatable to non-vegetarians. And ultimately, the DASH diet was studied, and it was studied in a series of studies. And the DASH diet was a randomized controlled trial of about 459 adults. They were randomized to 3 diets: a controlled diet, a DASH diet, and a diet that was kind of in between a controlled diet and a DASH diet. And they studied these folks for about 8 weeks, and they kept body weight and sodium intake the same. And most notably, they gave the participants the food, so they knew exactly what the participants were eating. And what they noticed was that those eating a DASH diet actually had the biggest decrease in blood pressure, and pretty quickly. Within about 2 weeks, folks had a decrease in blood pressure. That decrease in blood pressure was maintained over a subsequent 6 weeks. The controlled diet led to a slight decrease in blood pressure, likely because the controlled diet probably was still healthier than what the participants were eating to begin with. And then finally, the in-between diet, known as a fruit and vegetable diet, which is a little misleading, produced a result that was in between the controlled diet and the DASH diet. But the main takeaway is that a DASH diet, which included plant foods, could reduce blood pressure pretty quickly and keep blood pressure at a lower level. Ultimately, the diet was repeated with a sodium restriction arm to see if blood pressure would be reduced further, and indeed it was. And ultimately, that information was analyzed to see who had the biggest reductions in their blood pressure. The maximum reduction in blood pressure with diet was 21 points systolic and 8 points diastolic. And this is like going from a blood pressure of 150 over 90 to 129 over 82. So this is a really big reduction in blood pressure. And this reduction was seen in the folks who had the highest blood pressure to begin with in the study, those who had a blood pressure of 150 over 90 or higher. Ultimately, in this secondary analysis, the researchers went on to write that this is actually a bigger reduction than many blood pressure medications that are out on the market. And they provided this graph, and you can see that that they compare the DASH diet, which is this one here, compared to other types of medications. So the FDA requirement for a new blood pressure medication is relatively small. And then they provide examples of blood pressure reduction of various medications that are commonly used already by providers, including myself. And you can see that for ACE inhibitors, beta blockers, calcium channel blockers, blood pressure reduction is substantial, but it's not as much as the DASH diet, or certainly with the DASH diet combined. And then also sodium reduction by itself does provide a significant amount of blood pressure reduction as well. And the main takeaway is that the most blood pressure reduction you can get is when you combine a DASH diet with a low sodium diet, you get the biggest bang for your buck. My question is with this is that can you improve blood pressure even more by eating an exclusively plant-based diet? And we think that it is possible, although that has yet to be proven. But a few years ago, my colleagues and I wrote a paper on this. And we basically summarized all the evidence showing that plant-based diets do indeed reduce blood pressure and the reasons for it. So there are a few reasons why animal protein is associated with an increased blood pressure. This is due to the sodium content, which is relatively high. The potassium content tends to be on the lower side. Animal protein tends to be associated with weight gain, and as you gain weight, blood pressure does rise through a variety of mechanisms. Animal protein in itself tends to have amino acid types that tend to raise blood pressure for reasons that we don't fully understand. And there tends to be increased oxidative stress and inflammation with animal protein that contributes to a higher blood pressure. Plant protein, on the other hand, has been associated and studied to lower blood pressure. And the reasons are basically the opposite of what I stated with animal protein. These foods tend to be lower in sodium. They tend to be higher in potassium, which is very important in helping reduce blood pressure. These foods tend to be associated with weight loss. For every kilogram of weight loss, there tends to be a 1-point reduction in the systolic. These foods tend to have favorable amino acid types that help with reducing blood pressure. There tends to be less inflammation and oxidative stress. And there also tends to be a natural alkali, which is thought to help with lowering blood pressure. So for all these reasons, plant-based diets are helpful in reducing blood pressure, which is both a cause and complication of kidney disease. So the main part of this talk is talking about the effect of food on kidneys. This includes plants as well. And before we get into that, I wanted to give a little background on the main concern folks have with this area, which is protein. Protein is very important. Too much protein in kidney disease may cause problems. And I will now go into that evidence. So first, I want to talk about protein consumption by dietary type. So first, those who self-classify themselves as vegans taking about 82 grams of protein per day. Those who are vegetarian taking about 93 grams of protein per day. And those who are omnivores taking about 112 grams of protein per day. So as you eat less plant-based, you do take in more protein. It's not necessary that you take in that extra protein. But what happens is that with the kidney is that the GFR, which is the function of the kidney, increases as you take in more protein. That could be interpreted as a good thing. However, this increase is not reflective that the kidney is healthier. In fact, the kidney is just working harder to help excrete some of the breakdown and metabolic products of the protein. So you can see that the GFR, which is roughly correlates to percent kidney function, starts out at 100 for those who are vegan, increases to 105 for vegetarians, and goes up to 113 for omnivores. So as you take in more protein, that GFR number does go up, and it does make the kidney work harder. But the big question is this harmful or harmless for the kidney? And that kind of depends if you already have kidney disease or not. If you do already have kidney disease, it's likely harmful. And let me explain why. So the additional high protein causes this state called hyperfiltration, which means that the kidneys are filtering in a hyperactive state. So they are working harder to filter more. This hyperfiltration is a process of having additional blood flowing through the individual units of the nephron. Remember, you have about 1 million nephrons, and within each nephron is a glomerulus. And in this hyperfiltrating state, you have more blood flow going to each glomerulus. In a damaged kidney, this can cause even more damage. So the way to think of it is like, if you have a knee that is healthy, you may be able to run a marathon. But if your knee is already damaged and you try to run a marathon, you may end up damaging that knee even further. So that's the way to kind of conceptualize it in a very simple way. And this hyperfiltrating process is the underlying mechanism of damage in several common causes of kidney disease. That includes FSGS, diabetes, obesity, and cystic kidney disease like polycystic kidney disease. A big question that I get is, well, if protein in general causes hyperfiltration, what about plant protein? Does that cause less hyperfiltration? And there's actually only one study to answer this. This is from 1990, and it provides valuable insight. And they studied this question. And what they found was that indeed, animal protein does cause more hyperfiltration for the same amount of protein intake, and vegetable protein causes less hyperfiltration compared to animal protein. And if you are to eat protein, which everyone should be eating protein, eating vegetable protein may cause less damage in those with kidney disease. And there are additional benefits to plant protein, which we'll just discuss later in this talk. But this is one of several reasons to consider plant protein in kidney disease. Unfortunately, it was a small study for only 3 weeks, but it still is informative and still guides some recommendations to this day. Then the question is, does animal protein increase the risk of kidney disease if you don't have kidney disease? And there are a few studies, some observational studies, that show that the consumption of animal protein is associated with an increased risk of developing kidney disease, developing kidney failure, and also developing protein in the urine. So these are observational studies, and these studies have shown similar findings in those with kidney disease as well, meaning that if you have kidney disease and you eat animal protein, there have been studies suggesting that animal protein is harmful and may cause further damage. And in one study, replacing 3% of energy from animal protein with vegetable protein lowered the prevalence ratio for the association with renal function impairment to 0.20. This was an 80% reduction in risk. This is on the higher end of risk reduction, and this was from an observational study, so it should be taken with a grain of salt, but it's suggestive perhaps that there is something more to these foods. So why might animal protein be detrimental to kidney function? There's a lot of reasons. Some of the reasons include this hyperfiltrating state that we talked about, the renal acid load or the acid content of these foods. Many animal foods are acidic in nature. It could be related to the microbiome and the fiber involved, and TMAO, which results in inflammation, the sodium content, oxidative stress, and the lack of phytonutrients. So all of these things may come into play to affect kidney disease. Are all plant foods the same? Most definitely not. And we talked about this earlier. What is an example of a healthy plant-based diet and an unhealthy plant-based diet? And this has actually been studied. So this was a study involving almost 15,000 adults who were followed for 24 years to see if they developed kidney disease. Eating a healthy plant-based diet was associated with a 15% lower hazard ratio of developing kidney disease, whereas eating an unhealthy plant-based diet was associated with a higher risk of developing kidney disease. So what do they define as being healthy and unhealthy? So healthy and plant-based included fruits, vegetables, whole grains, nuts, legumes, tea, and coffee. And that's similar to what we described earlier. Unhealthy and not plant-based included refined grains, potatoes, and in this study, potatoes were lumped as unhealthy, which I disagree with. But the reason for being lumped into the unhealthy category is because many folks eat potatoes in the fried form, such as chips, French fries, things like that, which is not so healthy. But potatoes can be healthy and are healthy in their unfried form. If they're in a stew or if they're baked, potatoes can be very healthy and very filling. Other examples of unhealthy and or not plant-based food options included fruit juices, sugar and artificially sweetened beverages, sweets and desserts, animal fat, dairy, meat, fish or seafood, which in this study was classified as being unhealthy and not plant-based. But fish and seafood can be a great food. In some studies, it's been shown to be supportive of health. In other studies, it's been shown to be not supportive of health. And finally, eggs were classified as being unhealthy and not plant-based. A recent meta-analysis came out last year, and this meta-analysis looked at various food options and whether they were associated with the lower odds of developing kidney disease. And indeed, vegetables are associated with this. Some vegetables have historically been avoided in kidney disease for a variety of reasons, which we'll get to later. But as you can see here, many of these studies favor the consumption of vegetables for reducing the odds of developing kidney disease. And the net analysis also showed a significant finding. So going back to this, there are several potential benefits of a plant-based diet in kidney disease. And we talked about how plant-based diets could affect the causes of kidney disease, including diabetes, hypertension, and obesity. We talked a little bit about the progression of kidney disease. And then next, we're going to move on to the complications of kidney disease, which the first one includes hyperphosphatemia, which translates to an increased phosphate level. So phosphate levels rise in advanced kidney disease, and this is a big problem for kidney doctors like myself who want to lower this level to prevent the complications that may occur. Some of the complications that can come from an elevated phosphate level is, unfortunately, mortality, and having an elevated phosphate level is an independent risk factor for mortality. Phosphate restriction is recommended, meaning that we tell our patients to consume less phosphorus, but this is difficult because the phosphate content is not disclosed on nutrition labels. So it's hard to already restrict the consumption of some things like sodium when that is already listed on nutrition labels. So imagine trying to consume less of a micronutrient like phosphate when it's not even disclosed on a nutrition label. So it's almost a little bit like trying to fly in the dark. And because of this, adherence is difficult with this dietary recommendation. Some good news is that even though plant-based proteins actually have more phosphorus than animal-based proteins, this phosphate or phosphorus is mostly bound as phytate, meaning that it is not absorbable. Phytate is a storage form of phosphorus in plants, and because it is bound to phytate, it is not absorbable because humans lack the enzyme phytase. And this has led to the rule of thirds. And I borrowed this from this study that was published 12 years ago. And this study that you can kind of conceptualize the absorption of phosphorus into 3/3, 2/3, or 1/3, hence the name rule of thirds. And animal protein falls into the 2/3 category. So you get about 40 to 60% of phosphorus from animal proteins being absorbed. So this includes milk, yogurt, eggs, cheese, beef, chicken, turkey, and fish. These things are about 40 to 60% absorbed in terms of their phosphorus. So not all the phosphorus is absorbed, but about 40 to 60%. Plant protein or vegetarian protein, in this example, they use breads, almonds, peanuts, lentils, and chocolate. This comes out to about 10 to 30%. So you have 1/3 and 2/3. What falls into the 3/3 category or 100% is actually your dark sodas, your carbonated cola drinks, and this is 80 to 100%. So many of my patients already know this, but they know not to drink any sort of dark soda because the phosphorus load is substantial and it's pretty much all absorbed. And there's been a few studies on this issue, not too many, so we can kind of go through them. There's an observational study that those on a vegetarian diet were associated with a lower serum phosphorus level. Another observational study showed that those consuming lower amounts of plant protein were associated with higher urinary phosphate excretion, suggesting higher absorption of phosphorus with animal proteins. Another interventional study showed that eating 70% plant protein had lower urinary phosphate excretion. And finally, an interventional study by Mo et al. Showed that those on a vegetarian diet had lower serum phosphorus and lower urinary phosphate excretion. There are a few caveats that were recently published. Not all vegetarian diets are the same, and they can vary in their ratios of milks, eggs, and we talked about the different types of vegetarian diets a little bit earlier. Those variations, especially if you include more animal products, can contribute to a higher absorption of phosphorus. The other thing is that not all plants are grown under the same conditions. So even though in general, we say that plant foods have lower bioavailable phosphorus, the ultimate amount that is absorbed can vary because the plants may have different amounts of phosphorus and phytate depending upon their growing conditions and varieties of within a subtype of a plant. A big factor that affects phosphorus absorption is actually the way these foods are processed. Phosphorus can be added, and there's different levels of processing, and the processing of these plant foods increases the bioavailability of the phosphorus. And this is because there's less phytate binding to the phosphorus. As there's more food processed and this phytate bond becomes disrupted, and these are examples of various types of food processing. You can have milling, dehulling, soaking, germinating, sprouting, canning, autoclaving, yeast leavening, baking, heating, and extrusion. All these things work to destroy that phytate bond and then makes phosphorus or phosphate bioavailable for absorption. And because phosphorus is not disclosed on nutrition labels and exact bioavailability is not known, we have to estimate phosphorus absorption, and this is kind of tricky. However, when you look at studies, it shows that about 51 to 68% of phosphorus is bioavailable in lacto vegetarians, and this is less, somewhat less than their omnivorous counterparts, which ranges between 60 to 75%, and this difference may be larger in those who are totally plant-based. Certainly, we need more research, but in general, less phosphorus is bioavailable / absorbed in whole unprocessed plant foods, and phosphorus and processing of these foods increases phosphorus absorption, and soaking and rinsing may be a good way to reduce phosphorus load. And it's important to note that fruits and vegetables are naturally low in phosphorus, so these foods are good in lowering phosphorus levels. Another big complication of kidney disease is metabolic acidosis, and it's important to talk about. It's not commonly thought of, but for myself, I think about it a lot because it has a potential to affect the progression of kidney disease. And so let me take a moment to explain this. So kidneys lower acid levels normally. That's one of the many functions that they have, but these levels of acid rise in kidney disease because the kidney isn't working so well. Dietary proteins, especially those of animal origin, are the principal source of acid generation. And alkali has been shown to slow CKD progression. Alkali is a base. You can think of it as a base. It's the opposite of an acid. A very common form of alkali is baking soda, hence the photo there. So this is a graph of various foods and their acid or base potential. The average dietary acid load is net acidic in this country, and it involves 50 to 75 milliequivalents per day of acid. And the kidneys work to excrete that acid. And if the kidneys are not healthy and they have some level of dysfunction, as you can see, this acid load then starts to accumulate and then can cause problems. The net acid load of the average American is a product of a diet that's high in animal protein and low in fruits and vegetables. As diets include more animal-based foods, they tend to be more acid producing, and you can see this on the graph here. Hard processed cheeses are at one end, egg yolks, then follow, then you have meat, poultry, fish. Soft cheeses in the kind of neutral area, you have grains, rice, and pasta, lentils, milk, yogurt, wine, coffee, fats, and oils. And then you start moving into foods that are less neutral and more basic. And these include your fruits and vegetables, spinach, and then ultimately raisins. Raisins are listed all the way at the end because of the way this graph is constructed as milliequivalents per 100 grams of serving. Raisins are dehydrated grapes. So as such, they have a concentrated amount of base per 100 grams because the water content has been removed from it. But many dried fruits and vegetables would have a higher net base content. But for those with kidney disease, then the problem is potassium, especially with dried fruits and vegetables, but we'll get to that a little bit later. a vegan diet is nearly acid neutral, which is important to note because you can actually treat an accumulation of acid, which is known as metabolic acidosis, with fruits and vegetables. The current treatment or current gold standard for treating this condition in patients with kidney disease is with baking soda, also known as sodium bicarbonate. And several randomized controlled trials have shown that 2 to 4 cups of fruits and vegetables are just as effective as using baking soda. This is one of the few areas where we have a robust amount of randomized controlled trials showing a consistent benefit with using fruits and vegetables for the treatment of this condition. The reason fruits and vegetables are effective for treating metabolic acidosis is because they have natural alkali like citrate, malate, and bicarbonate. And this has been studied in stages of chronic kidney disease 1 through 5. And not only are they good for treating metabolic acidosis, but when they compared to studies using baking soda or sodium bicarbonate, they actually were better in other parameters such as weight loss, blood pressure, and urine protein. What was noted in these studies that those who ate the 2 to 4 cups of fruits and vegetables had more weight loss, they had lower blood pressures and lower amounts of urine protein. So there's just more benefit to eating these foods as opposed to taking a pill. And again, despite these foods being plants, there was no increase in potassium levels. And we'll talk about this a little bit later. So after some of these studies were published, an editorial was then written that the key to halting the progression of kidney disease might be in the produce market and not in the pharmacy. And they kind of compare and contrast the pros and cons of each. And as you can kind of see here, the pills have really one benefit, which is increasing the alkali intake, but they also carry a sodium load. But if you just eat natural alkali in form of fruits and vegetables, you get all these other benefits without that added sodium load. And so this kind of got people thinking that maybe we should reconsider how we treat this issue. The reason that they titled that as the key to halting progression of CKD is because the main purpose of these studies was to see if treating the acid levels would decrease the progression of kidney disease. And indeed it does. And the main researchers on this published their 5-year results a few years ago, and I have it here. And their life work can be distilled basically into these 3 graphs. And what you can see is that for those who are in the usual care group who receive no treatment for their metabolic acidosis, had a decline in that eGFR number, percent kidney function with time. It went down like this from about 40, down to about 20 for eGFR. For those who were treated with HCO3, which stands for just bicarbonate or baking soda, they started from the same point, but they decreased a lot less. They ended up around 26, 25 at the end of 5 years, as opposed to 20. And that they ended up around 28 or so, 27.5, 28, as opposed to 20. So substantially better than their counterparts who were not treated at all for this metabolic acidosis complication. Finally, you have the group that was treated, instead of being treated with bicarbonate, they were treated with fruits and vegetables instead, which is a natural way of treating this issue. And they started from the same place to make things even. And they ended up in pretty much a slightly better place or the same place as their bicarbonate treated counterpart, just to below 30, so 28, 29, compared to the 20 that was seen here in the usual group. And basically the take home point is that eating fruits and vegetables does slow down the progression of kidney disease by treating this acid accumulation. And for those who are taking a bicarbonate, that is fine. You're not going to get the added benefits of fruits and vegetables, but if you can do it with fruits and vegetables, it's probably better. The fruits and vegetables that they used were not anything that was out of the ordinary. They used just your regular run-of-the-day fruits and vegetables: apples, apricots, oranges, peaches, pears, raisins, strawberries. Vegetables included carrots, cauliflower, eggplant, lettuce, potatoes, spinach, tomatoes, and zucchini. It's important to note that these folks consumed potatoes and tomatoes, which have historically been avoided because of the potassium content, but we'll get to that a little bit later. And not only did they have this reduced progression of kidney disease, like I was stating earlier, they had lower weights. They lost about 4 kilograms, which is very impressive, just by eating 2 to 4 cups of fruits and vegetables per day. They also had lower blood pressures, about 8 millimeters of mercury less, which is substantial. And again, they did not have an increase in their potassium levels in their blood, which we'll talk about a little bit later. Another big complication of kidney disease, which is not very well appreciated, is the mortality issue. And I do want to talk about it. It's not a happy topic, but it's important to note because many of my patients with kidney disease are often afraid of dialysis. And that is something to certainly be afraid of, or at least to avoid being on. However, a bigger fear of mine is actually the fear of death. Kidney disease is extremely deadly. Those with kidney disease are 16 to 40 times more likely to die than to progress to kidney failure. And this may even be an underestimate, as I'll show in the next slide. Those with kidney failure don't fare any better. So if you make it to dialysis, still your chance of survival is pretty bleak. It's 42% at 5 years. And this is actually worse than some cancers. So this was just published last year. And this is looking at the risk of mortality in someone as they get older. And you can see that as you are if you are 25, 34, and you develop end-stage kidney disease and you're on dialysis, your mortality skyrockets by 500 to 1,000%. And it goes up to someone here that is of the age similar to the risk of dying of someone that is 84, 85 years old. Which is incredible to appreciate or even comprehend, but it helps put in perspective that preventing disease is much better than treating disease after it's happened. So it's something to take note of. The reason I mention it is that because some people have actually studied this in relation to diet. And if there's even an association, possibly a way to modify this unfortunate and dreaded complication. So this was a meta-analysis or a summary analysis of 6 prospective studies, including 14,000 people with kidney disease. And eating a healthy dietary pattern was associated with a lower risk of mortality, about a 27% decrease in risk. What they defined as a healthy dietary pattern included fruits, vegetables, fish, legumes, cereals, whole grains, fiber, and less red meat, salt, and refined sugars. Again, fish is a great food. So in this study, it was supportive of health. In other studies, it's been shown not to be supportive. And in a similar note, they looked at a different study looked at those who are already on dialysis. And as you know, that is a group of patients that's already a very high risk of fortunately passing away. This was 11 countries, 8,000 people with a median follow-up of 2.7 years. And what they found was actually 2 things. The first finding, which was unexpected, was that they found that folks on dialysis do not consume many fruits and vegetables. And that's likely because we as a healthcare society have actively advocated for not consuming these foods because of our concerns about their potassium, protein, and phosphorus content, some of which I've already discussed, and some of which, the remainder of which I'll discuss momentarily. So they actually had to measure the amount of fruits and vegetables being consumed, not per day, but per week. And the median number of servings was 8 per week, which is very low. And only 4% consumed the recommended 4 servings per day. And the final finding was that those in the highest tertile of fruit and vegetable consumption were associated with the lower risk of all-cause and non-cardiovascular mortality. So it suggests that perhaps these foods may be healthy even in those who are on dialysis. And this is kind of the halfway point. So I wanted to provide a little bit of comic relief of some of the famous kidneys. You will be tested on this later. My personal favorite is Kid Rock. At any rate, we'll move on. So the kidney stones, Fiber has been, so it should be kidney stone. Here we go. That was, I'm not sure why that was in there. Kidney stones, the prevalence of kidney stones is about 10%, and the prevalence is increasing. The most common stone is a calcium oxalate stone, and 78% of stones are indeed of this type, calcium oxalate. The risk of recurrence is 40% at 5 years and 75% at 20 years. You may have already had a kidney stone, or you may know someone who has had a kidney stone, because kidney stones are relatively common in society, and there's a lot of reasons why, and that includes the warmer weather. People tend to not drink as much water as they used to, and a variety of other reasons, including the consumption of animal protein. And this is published from the 70s, but it looks at data going back further than that. And there's just been a robust amount of evidence suggesting that the amount of animal protein is associated with the formation of kidney stones. And this goes back to World War II, or the end of World War II. And again, another paper from the 70s, just to show how old this thought process is that it's been asked several times, should recurrent stone formers or anyone who's had a stone become a vegetarian, in the hopes of preventing the formation of another stone. The treatment of kidney stones is one of the areas of expertise of mine, and I ultimately end up recommending a plant-based diet to almost all of my stone formers because of this reason. Is that the eating animal protein does increase the risk. And it's been written in studies time and time again that stone formers, or anyone who's had a kidney stone, should be advised to limit the intake of all animal protein, including fish. And the reason being is that animal protein increases the urine concentration of various things that all promote stone risk, including calcium, oxalate, uric acid, and acid levels. And that's not good if you've had stones, because that could cause you to have stones again. Unfortunately, people who have a calcium-based stone actually think that they need to eat less calcium, and if there's nothing that could be further from the truth than that. And this has actually been studied in a randomized controlled trial that was published in the New England Journal of Medicine some 2 decades ago. And what they showed is that it's not that you need to restrict calcium. What you need to restrict is animal protein and sodium. And that's an example of a kidney stone. They're very small. That's a fingerprint or finger in the background, so you can see the outline of a finger, of the fingerprint. But even though they're very small, they can cause big problems and certainly cause a lot of pain. And these are more recent studies showing that those eating a vegetarian diet have been associated with a lower risk of kidney stones. And this is coming from the EPIC Oxford cohort. And what they show is that of 51,000 people from England and Scotland, vegetarians had a 31% reduced risk of forming stones, whereas meat eaters were associated with a 64% increased risk of kidney stone formation. So why are plant foods potentially helpful or beneficial in reducing the risk of kidney stones? And there are a variety of reasons. This includes the lower urine acid levels, lower amounts of uric acid, lower calcium levels, sodium levels, and then also the increase in this all-important urine citrate or alkali levels in the urine. Because plant foods have citrate and potassium, you can actually use them to treat stones. And actually, the opposite has been done in the medical profession for decades. Instead of recommending folks eat fruits and vegetables, we've been actually just prescribing the relevant elements or micronutrients in the form of a tablet. We've just been giving patients with this problem potassium citrate, which is commonly prescribed for those with calcium oxalate stones, because, quote unquote, an alkaline ash diet or a vegetarian diet is too difficult to follow for most patients. And I find that a little disappointing on multiple levels. I think many patients are just not informed or have the opportunity to learn about this. Not only that, I think there's not a lot of time for providers to do that within the current constructs of the health system. And then finally, I think we are not set up as a health system to support patients in their transition to a healthy diet. The current system is kind of is set up for the prescribing and dispensing and the ingestion of medications, which is helpful in many contexts. But in this context, telling someone to eat healthier may be more beneficial and have more benefits than just taking a potassium citrate tablet. As you can see, potassium is found in fruits and vegetables, and so is citrate. So it's not surprising that you can get the same benefit by just eating more fruits and vegetables. And I have had several patients who've come to me taking potassium citrate, and then we've ultimately been able to get them off of the medication by increasing the amount of fruits and vegetables being consumed on a daily basis. So that is very fulfilling when that happens. But what about all the oxalates in plant foods? So many of you may have heard this term oxalate, and that has been associated with oxalate stones. Oxalates are very important in plants because they bind to calcium and they facilitate the growth of plants in the areas of high calcium levels in the soil. Unfortunately for humans, that oxalate can bind to calcium in the diet and then form stones in the kidney. That can be problematic. Some foods are extremely high in oxalate. And examples of that include spinach, Swiss chard, beet, greens, rhubarb, cashew, starfruit, dark chocolate, potatoes, and black tea. And certainly, if you ate all those foods and you had a couple other risk factors, you could develop a kidney stone that way. But there is more to it than that, and recent evidence suggests that restricting amount of oxalate does not necessarily reduce the amount of oxalate in the urine. And that is because absorption varies depending upon the solubility of the oxalate in the gut and the other aspects of diet, like the amount of calcium that is being absorbed or the amount of calcium that is being consumed. And there also is the emergence of research from the gut microbiome, such that certain bacteria like Oxalobacter formigenes may digest oxalate and prevent its absorption and ultimate excretion in the urine. So it's not so straightforward that eating plant foods will cause kidney stones. Certainly they can. And so I do see some people who have this issue of having too much oxalate in their urine, but that is generally a rarity and not the rule. And these folks do see me in the clinic, and I monitor them and we adjust their diet as such to reduce the levels of oxalate in their urine. And certainly, if you are someone that's in this situation, you should consider seeing a nephrologist so you can be monitored appropriately. But it doesn't mean that if you have that for the average person, that if you eat some nuts or some spinach, that you will immediately have a kidney stone. And actually, that's not likely to happen. There are other risk factors that folks should pay attention to. If you have bowel disease, bowel surgery, recent antibiotic exposure, or you take vitamin C, which I generally don't recommend, you can put yourself at risk for forming a stone. So folks with these comorbidities or these risk factors will also want to pay attention or perhaps see a nephrologist to avoid problems. So now we move into the risks of plant-based diets in kidney disease. Big risk is potassium. And I didn't know how much time we'll have because I normally don't do 2-hour talks. I usually do my talk within an hour. But since we have a lot of time left, I actually want to switch PowerPoints and do a deeper dive into this. And I have a whole separate PowerPoint on potassium. So I'm going to exit this PowerPoint and switch to my other PowerPoint, which is plant-based diets in kidney disease as it relates to potassium. And
Doctor, this is Ben. You're good on time. We love everything you're sharing with us. So we have until 3 for our next lecture. If you have time for Q&A, great. And if you want to just share with us until 3, whatever is best for you.
Okay, no problem. I appreciate that. I am just trying to move this black bar. There we go. So I can click the slideshow button. There we go. Okay, so a big concern is potassium in kidney disease with plant-based diets, and that's why I wanted to segue into this whole separate talk on this. And after we get through this, I'll move back to the original talk.
Dr. Joshi, just to interrupt you, but you have to also click on from beginning from the PowerPoint presentation. Do you see that on your the potassium one?
Can you see that?
No, not yet. Actually, can you? Yes, redo the share screen.
How about now?
Okay. Yep. Now hit play from current slide. Yep. Great. Now we see it. Awesome.
Okay. Great. Okay, so just a little background on this. So historically, the renal diet, people thought that there wasn't much to eat because so much had been restricted from the renal diet because of potassium issues, phosphorus issues, protein issues. And some have even gone on so far as to write, is there anything left to eat? And if you ask patients who have been following a kidney diet, they will tell you that there isn't very much left to eat. And if you further restrict it with diabetes or gluten intolerance or something else, it becomes very challenging. One of the big restrictions in in these diets was actually the amount of potassium. And previous recommendations have stated to limit the potassium content to 2 to 4 grams for those with CKD stages 3 and 4. These recommendations were based on a very low level of evidence and were actually primarily opinion-based. As of recently, updated guidelines have stated that that basically what you can do is just adjust the amount of potassium you're taking in to maintain the amount of potassium that is in the blood. And the guidelines don't give a hard number as to how much to aim for because they are acknowledging that there isn't a whole lot of research in this area, and that if you have low potassium, you should probably eat more. If you have high potassium levels, you should probably eat less. But we can take that one step further and to look at whether plant-based foods contribute to high potassium levels. And many still continue to recommend to avoid eating plant-based foods like seeds, nuts, beans, peas, as well as fruits and vegetables. And again, despite this recommendation, there's very little evidence to support that fruits and vegetables increase potassium levels. And I want to look at the evidence that exists for those who are not on dialysis and who just have kidney disease. We recently published a paper on this year, so you can find all this information there. This was written by my research assistant, John Babich, who did an excellent job. And what you can see here is that when you look at the studies, there's only been one instance of someone having a high potassium level while eating a plant-based diet or eating a portion of their diet from plant foods. And this was in someone who had a pre-existing type 4 RTA, which stands for renal tubular acidosis. And the authors go on to write that this person had 2 instances of an elevated potassium level. And in both these instances, they modified their plant protein source from raw edamame, which is a food that contains a high amount of potassium, to fried tofu. I don't necessarily recommend frying tofu or eating fried foods in general, but this is what they did. And this resulted in a normalization of the potassium level. A little background on this issue: type 4 renal tubular acidosis is a medical problem from the state of having too little aldosterone in the blood, and this ultimately causes high potassium levels. So this person had a pre-existing reason for having an increased potassium level, and it's likely that the plant-based foods in general don't do this in people who don't have this problem. So to look at the list of foods that are high in potassium, you can see that molasses takes the top spot. And it's because of the way that this table is organized. And what you can see is that it's organized by cup. So in terms of cup, molasses has a large amount of potassium, but no, I don't think anyone eats a cup of molasses on a regular basis. More relevantly, if you go down the list, you see that the list then starts to be filled with beans for the most part. And if you're eating raw beans or seeds, you can run into this problem, but many people don't eat raw beans. Most of the time we are cooking them and hydrating them. And 1 cup of beans, of raw beans, generally turns into 2 or 3 cups of cooked beans. So then the potassium content is reduced that way. And of course, in the boiling process, you may leach some potassium and reduce potassium content further. Going back to those famous metabolic acidosis studies and talking about the 2 to 4 cups of fruits and vegetables, those studies did exclude patients or participants with a baseline potassium level greater than 4.6. And as I mentioned, they ate all these fruits and vegetables, and they did not see an increase in potassium level in those studies. Granted, they excluded folks who were at the higher end of a normal potassium range. They did study patients or participants with stages stage 1, stage 3, and stages 4 and 5. And in all of these studies, they did not notice a significant increase in the potassium levels, which is good. Other people have looked at stage 5 kidney disease, and again, no hyperkalemia or elevated potassium levels were noted. And this older study from 1996, they published their 3-month data, but for some reason did not publish their 14-month data. And I've been unable in trying to get this information from them. But other studies have suggested the same thing. And I get many questions on the issue of potassium in those on dialysis from dietitians and patients and healthcare providers. And the same thing, it can be found there as well. If you are on dialysis and are eating a plant-based diet, studies suggest that there is no increase in potassium level. And we have data from cross-sectional and prospective studies to support that. And as you can see here, these are studies that do not show an increase in potassium level. And you can even look at just potassium in general. What about just eating potassium from any source? Does this result in an increase in potassium in the blood if you are on dialysis? And there's actually only one study that showed a small association, and this was the Nouri et al. Study from 2010. This was a prospective study that lasted 5 years, and this study did show a very weak correlation between dietary potassium and potassium levels in the blood. This was the finding from that study, and what you can see here is that potassium level did increase with increasing potassium intake. This was potassium intake from all sources, but the level of increase was very, very small, despite having a very big increase in the dietary potassium intake. In another study that talked about this, they said that only the dietary potassium only explained about 2% of the variance in the pre-dialysis serum potassium levels. Another way to put it is that even though the dietary potassium intake went from a low of 500 to a high of 4,500, which is a 9-fold increase, serum potassium only went up 0.4 milliequivalents per liter. So again, a very small increase in this one study for a very large increase in potassium intake, whereas the other studies have not shown an increase in potassium, whether you look at it from plant-based diets or all sources of potassium being consumed. So all of this is reassuring. And then this is another study that looked at dietary potassium and serum potassium. This is a balance-wise study, and there is no association, just looking at the scatter plot of the data. And if there was an association, what you would see is this kind of linear line going from the lower left-hand corner of each graph, going to the upper right-hand corner of each graph, but you don't see that. These dots are arranged in a way that you can just draw a straight line through it like this, and you would not see, and there's no association. So then the question is, how do we explain this? Why would serum potassium not increase with plant food consumption? And this kind of leads us to potential mitigating factors. And this is kind of the fun and exciting part about plant-based diets and kidney disease, is that there are perhaps some other aspects to plant foods that are beneficial in this regard. So fiber leads to larger and more frequent bowel movements. And this is important because as you have more bowel movements and larger bowel movements, this leads to more potassium loss. The colon can actually secrete potassium in a compensatory way. So if you have a decline in kidney function, if you have kidney disease, you're on dialysis, the colon in a remarkable and adaptive way can increase the amount of potassium that it excretes into your stool, into the feces, as a way to reduce the potassium levels in your blood. And this can include up to 31% of dietary potassium. There is a study out there that said this number was up to 80%. My colleagues and I that recently wrote this review paper, we disagree with that. We think the number that can happen on a more routine basis is around 30%. Finally, plant foods can drive the intracellular movement of potassium. And this is important because you can move potassium from the blood back into other compartments of the body due to the plant foods having fiber, which improves insulin sensitivity, and then also natural alkali, which helps to reduce the acid levels of the blood. And then finally, there may be some contributions to the bioavailability of potassium that's affecting how much potassium gets absorbed. This is a new and hot topic. It's yet to been definitively proven, but it's still food for thought. So the colonic secretion of potassium is an important consideration that I alluded to earlier. About on average, 12% of dietary potassium is excreted into the colon. In those with ESRD or on dialysis, this number can increase to 24 to 31% on average. And there's studies going back to the 60s that show that stool potassium excretion increases as kidney function declines. So this is shown in a reverse way. So kidney function declines as you move along the x-axis towards zero. And then if you look at the y-axis, these dots increase, and that's the reflective of stool potassium excretion. The two other findings from those series of studies, it showed that stool potassium increases with increasing stool weight, which makes sense, and then also increases with increasing potassium intake, which is also interesting, and that's probably reflective of potassium being associated with fiber or some other mechanism that helps increase its excretion in the stool. More recently, studies have shown similar findings. Potassium is secreted in the colon, and this increases in those who have kidney problems. This is net colonic secretion of potassium in those with normal kidney function and those who have kidney problems. Back in the 80s, chronic kidney disease was called chronic renal failure. And as you can see here, those with chronic renal failure have higher amounts of colonic potassium excretion compared to those who have normal kidney function. Again, all very remarkable. More recent studies have shown that this is mediated by channels within the colon. These are called these high conductance BK apical potassium channels in the surface of the colon. There's these epithelial cells that have these channels. And basically what happens is that they excrete more potassium in those with kidney disease. This is a visual analog score of these channels. This is someone who has no kidney problems. And as you can see, that's a reference range. And those who have kidney problems have an increase in these channels to help increase the excretion of potassium in the colon. So this kind of leads us to the discussion of potassium in poop. And of course, there is potassium in fecal content. And if you are constipated, that potassium does move into the colon, but then it's not excreted from the body. So you would have potassium going into your colon, but then it wouldn't continue to move into the colon because that stool burden isn't being eliminated on a regular or frequent basis. On the contrary, those with diarrhea have moderate to high losses of potassium per day, which is why we see patients who get admitted with diarrhea or come to the emergency room with diarrhea from food poisoning or some other reason often have low potassium levels. because they're losing so much potassium in their stool. Plant-based foods are high in fiber, which can increase the amount of increase the bowel size and frequency, and this facilitates potassium excretion. About 53% of patients on dialysis unfortunately have constipation, so they can't regularly take advantage of this natural mechanism to increase their potassium excretion, which is important in those on dialysis. A word about fiber. So fiber does increase potassium excretion in the stool. And this is someone who was not on dialysis. This person was close to being on dialysis. It's a study from the 80s, and this person just ate 7 grams of psyllium or fiber, 3.5 grams twice a day. And this led to a 32% increase in potassium excretion after 11 weeks, which is an enormous increase in potassium excretion just for a very small amount of additional fiber. 7 grams of fiber isn't even what's recommended for someone in a day. It's a third to a fourth of the amount of fiber that's recommended on a daily basis. So a very small addition of fiber per day can lead to a substantial increase in the amount of potassium being excreted. Granted, this was one study from one person, but certainly food for thought. The bioavailability of potassium is a recent consideration. Just it's similar in thought process to the issue of phosphorus in plant foods. Some people think that the presence of cell walls in plant foods helps prevent the absorption of all of the potassium in plant foods, whereas animal foods do not have cell walls. And there's a variety of studies to suggest this. This study done by Naismith was a 10-day crossover feeding trial of 11 volunteers. And they basically looked to see how much potassium could they recover in people eating a high bioaccessible or high bioavailable diet, which included a lot of animal foods and fruit juices, and compared to a low bioaccessible diet, which included a lot of unprocessed plant foods. And what they concluded was that the bioavailability of animal foods and fruit juices in terms of potassium was about 96%, but in unprocessed plant foods, it was little more than 60%. And it's interesting that they write a little more than 60% was because when I went back to look at other studies that have looked at this, I got a very similar number. The only study that stuck as an outlier was the study on potatoes, which gave a number of 94% and is at odds with the rest of the literature. I only provided to provide a complete picture of the evidence out there, so that we still have to figure out why this is for potatoes. But the remainder of the studies have looked at bioavailability of potassium from plant foods. One of them is the DASH trial. That bioavailability number of potassium is in the mid 60s or a little bit more than 60%. For a standard American diet, it's about 87%. For those on the DASH diet or eating a mixture or a portion of the DASH diet, it's 67%. So you get a number that's in the mid 60s in terms of potassium bioavailability. And that may be due to the cell wall issue, maybe due to fiber or something else, but that number is recurrent in the literature. And as I mentioned earlier, there are 2 types of 2 DASH studies. The first DASH study did not look at sodium restriction, but the second DASH study did. The second DASH study showed that the bioavailability of potassium in those foods was again somewhere in the mid 60s, 62, 68, 68% on the DASH diet. And again, the DASH diet was studied in those with kidney disease. It was a small study. And in this study, again, they found the bioavailability of potassium was 61%. So it's not unreasonable to estimate that the potassium in plant foods is about 60 to 70% bioavailable based on these studies. There are some caveats to this, so there's some problem foods. So the catch to this is that certain foods can increase the amount of potassium being absorbed. This was a review of case reports causing hyperkalemia, and it was stratified by dietary intake, and it was not restricted to those with chronic kidney disease. It's a very interesting paper. Most of the case reports are attributed to juices, sauces, and dried food and not unprocessed plant foods. Bananas tend to appear probably more often than would be expected, given the spectrum of possible fruits and vegetables that are out there. And I think that's just due to recall bias, as many people tend to associate bananas as being high in potassium, even though bananas are not one of the highest or high potassium containing foods when you look at tables of potassium content of foods. The reason juices and sauces and dried fruit are probably overrepresented in this is because they increase the amount of potassium being consumed per unit time. A glass of orange juice, for example, has a potassium content of 2 or 3 oranges. You may have a couple glasses of orange juice and you may get a substantial potassium load from all the oranges that have been used to make that orange juice that was just consumed. And it's a similar idea with dried fruits. Dried fruits are dehydrated, so dried figs and plums, for example, have a high potassium load. This is looking at it per 100 grams. So if you dehydrate, take out the water content, instead of eating a plum or two, you could have 10 dried plums and then get a substantial load of potassium. So even though you're absorbing about 60 to 70% of that potassium, 60 to 70% of 10 dried plums worth of potassium is still a lot of potassium. So this is where dried fruits, sauces, and juices can become problematic. And for this reason, I recommend avoiding these things in those who have kidney problems. For the sake of time, we'll skip over this mortality issue. We'll jump to the end here. There are some non-dietary causes of hyperkalemia that are very important to remember. If you have a high potassium level, it's not necessarily a function of diet. There could be other things that could be affecting it. Several medical reasons that a doctor could look into. This includes constipation, kidney disease, which we're talking about, exercise, medication side effects, type 4 RTA, which we discussed. Many medications are associated with high potassium levels that have nothing to do with diet. So that's important to note. Metabolic acidosis is a big contributor to high potassium level, especially in kidney disease, and it's important to treat that. And that can be done with fruits and vegetables. So now at this point, we can just jump back to the original PowerPoint. I just wanted to go do a deep dive with potassium. We could go back to the original PowerPoint and wrap it up there.
That's great, Doctor. And so do you need a little extra hand from our tech team to just get back in, or?
I think I am there.
You nailed it.
Oh, good. I am teachable. So we just went through all this a little bit more in depth. And finally, to just mention, my colleagues and I wrote this paper, which we spent years thinking about, and it finally came out this year. And it summarizes this literature, and we're all actually really proud of this paper. Another big concern, to jump back to the original table of contents in this PowerPoint presentation, is protein. I could do a deep dive into protein, but suffice it to say that several studies have looked at whether you can get enough protein in kidney disease on a plant-based diet, and all of these studies have shown that indeed it is possible to do so. This Italian study showed that you can get 0.7 grams per kilogram per day. Another Israeli study showed 0.75 grams per kilogram per day. This has even been shown in patients on dialysis who need a higher amount of protein intake because of inflammation on dialysis, losses of protein during dialysis, and decreases in appetite and various other things. So patients on dialysis are recommended to get 1 to 1.2 grams per kilogram per day. Two studies that looked into this show that folks were getting 1.2 to 1.25 grams per kilogram protein per day without any nutritional compromise. And of course, this can be modified to include more protein containing foods like beans and lentils to help attain even higher protein targets. And a few years ago, we did summarize the literature on this, and it is possible to get enough protein. You just have to eat a balanced diet. If you ate a diet that was exclusively based on apples and tomatoes or apples and pears, just something extremely restrictive and something that the average person wouldn't do. You could run into trouble, but most people don't do that. And in fact, if you have any sort of kidney disease and are wondering what to eat with kidney disease, it's recommended to see a dietitian to avoid running into problems and just to be sure that you're doing the thing correctly. And also, of course, talk about it with your doctor. We are towards the end, so I just wanted to mention this topic, which is reversing kidney disease, which is everyone's favorite topic. I want to acknowledge that there are some hypothetical, not hypothetical, there are some hypothesis generating pieces of evidence from case reports that show that substantial improvement that's bigger than what would be expected just from diet alone. I put it out there just to show what does exist. It's not meant to say that you should stop your treatment or stop seeing your doctor and abandon caution and embrace whatever diet is prescribed, but perhaps maybe to offer hope or to spark a conversation with your provider. One such example is this case series in patients with lupus and lupus kidney disease, which is also known as lupus nephritis, which is very difficult to treat. In the two cases, both had improvements in that GFR number, which is a percent kidney function. One went from 14 to 27, and the other went from 53 to 73. One of my favorite cases of remission is this gentleman named Dwayne Sunwald. Dwayne Sunwald and I had the pleasure of speaking together at the National Kidney Foundation a few years ago, and we'll be speaking again later this month at NephCure. He's a remarkable human being who is a chef, was a former patient of kidney disease. He was diagnosed with minimal change disease. And as you can see here in his own words, by replacing animal protein, plant-based protein, I was able to put CKD into remission. And this was published in a major medical journal that was trying to give a voice to patients, because as physicians, we don't often see this in the literature. We want to, and in this attempt to do so, it was an opportunity to shine a light on Dwayne's case. Dwayne is actually no stranger to publishing. He's published a variety of times about his own story. And the story is remarkable. He had severe kidney disease, tons of protein in his urine. He also had a creatinine of 2. His eGFR was low, and he was biopsied. And he did not have diabetes or high blood pressure. He had an autoimmune disease called minimal change disease. And despite being immunosuppressed with steroids and other chemotherapeutic agents, his disease progressed, and ultimately he switched to a whole food plant-based diet, included some swimming. He lost 60 pounds. His kidney function improved almost immediately, and he regained his life. And he writes in this article that he appreciates the recommendations his doctor gave him to increase the amount of plant-based foods he was eating. He thought his life had been gone forever. And now, because of that, he had been and continues to be able to keep up with professional work demands. He swims regularly, and he gives talks on this topic with physicians like myself. So in the last few minutes here, I just want to offer a big picture and conclusion. So this is me going back to 2008, and with each passing year, 2008 looks further as a distant memory. I had just started medical school at the University of Miami. I had no idea what kind of doctor I wanted to become. And normally when I give this talk, mentioning the Welcome to Miami song, usually is not awkward, but in this situation, given recent experiences or events, it's a little awkward. But at any rate, I clearly did not know what would come in the future of my life, but I was very interested in kidney transplant and kidneys. So I started to do a lot of research, and because of the work and support of 2 important mentors pictured here, I was able to get involved in this area and do research and contribute to this area. The big issue in kidney disease is, many folks have progression of kidney disease and ultimately need a transplant. And if you go back to at that time, the supply and demand of kidneys was very mismatched. The demand for kidneys, as listed in the orange, outstripped by several fold the supply for kidneys provided in the blue there. And it just continues to get worse. It's gotten slightly better in recent years, but as you can see, overall demand for kidneys exceeds supply. And this is just a brief glimpse into some of the work that I was privileged to be a part of with that team down there, just looking into some of these issues and trying to address some things. But ultimately, I decided to do research after med school to work on some projects looking into artificial kidneys. And ultimately, I did go to residency and fellowship and become a doctor. But during that pivotal year, I learned some things. And one of the things was that making an artificial kidney is incredibly hard and if not impossible because of just all the technological requirements that are needed. And even though we're now living in 2022 and science has progressed a lot, there's just some things that are very difficult to overcome, like keeping cells alive in a bioreactor for an extended period of time and clotting and things like this that continue to plague the progress of artificial kidneys. At any rate, but what I did learn, and as well we talked about at the very beginning, is that the causes of kidney failure, the number one, number two causes are diabetes and high blood pressure. And then the light bulb kind of went off. Type 2 diabetes and high blood pressure need not happen. Type 2 diabetes and hypertension need not be uncontrolled, and they certainly need not cause kidney failure. And when you look at it closer, 90% of all diabetes is type 2. I understand that type 1 diabetes is autoimmune, but we're talking about type 2 diabetes. And 90% of diabetes, of all diabetes, is type 2. And 90% of type 2 is preventable. And 80% of high blood pressure is preventable. So we're looking at very big percentages of the two most common causes of kidney disease. And this reminds me of the saying of the first human heart transplant surgeon, Christian Barnard, who was in South Africa. He says that I have saved the lives of 150 people by heart transplants. If I had focused on preventative medicine earlier, I might have saved 150 million. And that's just so important and right and very true. And a lot of my work kind of goes to that. The idea is just to move people along the spectrum. An ounce of prevention is worth a pound of cure. I've been very privileged to work here at Bellevue Hospital in our plant-based lifestyle medicine program, which helps patients eat healthier, exercise more, reduce stress, and live a healthier life in the hopes of preventing complications of diseases. So in summary, the role of plant-based diets in kidney disease can prevent the causes of kidney disease like diabetes, hypertension, obesity. If you already have these diseases, it can help prevent the progression. It can help control them. Not everyone has a miraculous cure, but most people have some improvement, certainly. It can also help reduce the complications of kidney disease, high phosphate levels, acid levels, blood pressure that comes from a kidney disease, uremic toxins, which we didn't talk about too much in this talk, and then, of course, the dreaded mortality issue. And then it can also attenuate the progression of kidney disease, like the decline in that all-important eGFR number and the amount of protein in urine. And of course, all this comes from a recent paper that was on it. And the work of myself and several of my colleagues has led to a reconsideration of what is a renal diet. And we're moving towards adopting this diet called the Plato diet, which stands for the plant-dominant low-protein diet for kidney disease. And this may be what the future renal diet looks like. It represents avoiding too much protein to avoid taxing the kidneys, as I mentioned earlier. It emphasizes plant sources for protein, and it also restricts sodium, emphasizes fiber, and it's hoped that by doing so, this will prevent kidney disease, prevent the progression, prevent kidney failure and dialysis, improve cardiovascular health and survival, and overall improve things that are important to patients like quality of life and dietary palatability and adherence. So we hope that is the future. This talk is the product of the insight and guidance and mentorship of many people over many years, and I list just a handful of them, running out of space to thank all of them. And of course, I want to thank all of you and to this conference for having me and inviting me and giving me the opportunity to talk about one of my favorite topics. And with that, the remainder of 24 minutes or so, I'm happy to take questions.
Wow. Thank you so much, Dr. Joshi. And, I really love the way you listed the shoulders that you stand on. And the truth is you continue to pioneer their work and your work and on behalf of all of us. So thank you. We really, really do appreciate that and everything you shared today. That said, I see a couple of hands raised. I want to make sure that you and everyone else here knows how we go about it here with our live Q&A. And that is very simple. We'll set them up for you. You'll knock them down. We ask everybody to go ahead and raise their hands. We usually don't take questions directly from the chat box. So again, I see a few raised hands coming in already. For those of you that don't know how to raise your hand, down at the bottom of your Zoom window, you'll see different tabs. One of them is the reactions tab. You click on your reactions tab and you'll see different emojis come up, and one of them says raise hand. You click that. And again, we'll see your raised hand and we'll go ahead. I will actually call you by your first name and unmute you. And with that, Doc, if you're ready.
I'm ready. Let's do it.
Right. Appreciate it. Thank you so much. And so the first person we have is Mike. Welcome, Mike. Oh, Mike, I'm not hearing you. Are you there?
Yeah, so you hear? Can you hear me? Can you hear me?
We got you now. Thank you.
Okay. Sorry, I apologize. Doctor, very good discussion. Glad we're talking about kidneys. It's something that most people don't know much about, and I was naive about a lot of the things. And it got me thinking. I was wondering, a lot of people have said in the past that I've listened to that the human body is basically run on ion pumps with potassium and sodium. So I thought about it when you were talking about the kidney and potassium and sodium. Is there anybody done any kind of work with, I think yesterday, Mr. Uber, I had a charging mat where he was talking about grounding the electrical charge of the body, like putting your feet in the grass, that kind of thing. Would that be any way that might help somebody that's acutely affected by kidney and or stabilize their metabolism or chemistry?
It's a good question. And in all the papers that I've read and in my area of expertise, I have not come across anything like that. But you're welcome to look up this yourself. Many of the tools that I use to answer these questions are available to the general public. I use Google Scholar, I use Google, I use the PubMed search forum. But as far as I know off the top of my head, I have not come across anything like that.
Got it. Thanks very much for that, Doctor. And up next, we have David A. Hi, David. Welcome.
Hi, how you doing? I was wondering about kidney stones. I was always taught that the best way to avoid kidney stones is drink lots of water and lemon juice. Would you agree with that? And secondly, you said that you don't agree with vitamin C supplementation. Has that have to do with ascorbic acid, or do you also say you shouldn't take vitamin C supplements if it's food-based, like with amla powder? And then finally, would you say that transplants are the best hope for people with dialysis?
Yeah, so all those questions are great. I hope to keep them all in my head. So you're spot on about the water intake. So the three cardinal rules that I give to all patients with kidney disease is to drink more water. I myself had kidney stones in the past, and that is actually a product of not drinking enough water. Growing up in Florida, the Florida heat, I did not drink enough water. So the first rule I always say is drink plenty of water. You want to get one of those reusable water bottle containers, fill them up. Many places at work, airports, places have those refillable things you put underneath, and it senses and the water comes down. You want to drink 2 to 3 liters per day. Some people have chronic kidney conditions, that like heart failure or liver failure, and even some advanced situations with kidney failure, have to balance that with restricting too much water, because that can put them into a different problem. The second thing I tell patients is to avoid eating salt. Salt increases the risk of kidney stones. The way to think of it is that salt in the body, what salt you take in is the salt you pee out. The salt you pee out increases the calcium you pee out, which increases the risk of forming a calcium-based kidney stone. That's number two. So drink more water, cut out back the salt. Third is to cut back on animal protein, which we talked about extensively. Your question regarding the vitamin C is a good one. Vitamin C has been all the rage ever since the pandemic started. Many well-intentioned folks take vitamin C to improve their immune systems. They take super therapeutic doses. However, that can vitamin C gets turned into oxalate, increases the risk of oxalate-based kidney stones, which is why I don't recommend to get vitamin C, especially vitamin C in a supplement form. You're better off getting vitamin C by eating a fruit. If you're someone that doesn't have impaired kidney function, you could do fruit juice. That can cause problems with the glycemic index, can increase blood sugar levels, can also increase potassium levels if you have kidney issues. But so preferably to eat a fruit. You can get vitamin C, you can get natural alkali that way. The recommendation to drink water with a little bit of lemon juice is basically to make water alkaline. This is a complex nuance with dietary management of kidney stones, is that even though lemon juice is acidic, there is a compound in there called citrate or citric acid that when absorbed by the body turns actually into a base. So this is like kind of the trick with lemon juice and lime juice. You could use either or any citrus juice for that matter with water, or you could just eat the citrus. But the trick with that is that it gets turned into a base by the body as the body metabolizes it, and bases and alkali are beneficial not only in kidney disease, but also for a treatment of kidney stones. And then finally, your last question about transplants is that yes, transplants are the way to go. They extend the quality and duration of life substantially. And if you're lucky enough to get a live donor kidney transplant, meaning a kidney that someone donated to you, that's the best possible way to go.
Thanks very much, Doctor, and for all of that. And let me now go to, sorry about that. Let's go to Stephen. And hi, Stephen, welcome.
Thank you. I want to thank you, Ben, for being a very good moderator. I want to thank the doctor for an excellent presentation. And I just want to let him know that, my creatinine was rising over the years. And about 10 years ago, I shifted to a whole foods plant-based diet, and it's come down a little bit. And so I don't do any of the processed junk. It's like beans and greens and oatmeal, and I've been stable. I'm at like 1 point. I was at 1.3. I'm at like 1.1, 1.15. It's not getting any better, but it's not getting any worse. And my plant protein is probably around 60 to 70 grams a day. A lot of it is from cooked beans. I'm just looking for your comments. No, I don't do any animal products whatsoever.
Yeah, that's great to hear. That's amazing. I'm glad to hear that your kidney function has not progressed, that you've been able to adopt a plant-based diet. Certainly, you should see a doctor or a dietitian just to make sure that what you're doing in the details are appropriate and you're not missing anything. But that's really great to hear. That's many of the patients I see have kidney disease, plant-based diet, and a lot of the time we spend is just going through those details. So from what I hear, it sounds good, but important to have someone who's familiar with the subject kind of go through all the details with you, make sure you're not missing anything.
Thanks, Dr. Joshi. And up next, we have Kathy. Welcome, Kathy.
Hi. Thank you for taking my question. My question is, when you're a kid, you can eat anything. And as you get older, you often hear people say, oh, I can't eat that anymore because I get fluid in my ankles. So my question is that fluid in your ankles a function of the kidney no longer working the way it's supposed to? Or what happens that causes that?
Yeah, a lot of people have that problem. That could be a problem of the veins. The veins not just being strong enough or having enough elasticity to keep the blood towards the top of the body. So a lot of folks, as they get older, they lose some quality of their veins, and this contributes to some swelling in their lower extremities, usually the area that's most dependent or at the bottom of their body. This can be made worse by some medications. So like some of the calcium channel blocker class of medications that is commonly used to treat high blood pressure has the side effect of causing leg swelling. So I've seen that before. The other big thing, of course, is sodium, is salt. Eating too much salt. Almost every time I mention this to a patient, they say, hey, we don't eat salt. And then that may be true that they don't add salt to their foods. I think many people know the harms of adding salt, with the salt shaker. But what they may not realize is that a lot of the salt is already added by the preparer of the food, whether be it in a factory, if it's processed food, or in a restaurant, or someone else is making it, that salt is already added. So for example, bread often has a substantial sodium load, and many people don't realize that. And if you look at the diet, bread is one of the top 3 sources of sodium. Cheeses are another big source of sodium. And then, food that's just eaten out, the sodium is added a lot of times to make food tasty because we're calorie conscious, we're fat conscious. So a way restaurants get around it is by adding sodium. And certainly if you have kidney problems, if you have liver problems, if you have heart problems, your body is in a state where it wants to hold on to sodium or it's not able to excrete the sodium that you're taking in. So this can lead to a state of sodium accumulation where you just are holding on to all the sodium, and that can lead to swelling in the legs. So there's a variety of reasons. Some people use compression stockings, some people elevate their legs, some people are on water pills. The exact reason can vary. So always best to talk to a doctor about it or have it looked into professionally.
Thanks for that, doctor. And excuse me, up next we have Melissa. Welcome, Melissa.
Hi, thanks so much for taking my question, and thanks for a great presentation. And forgive me if you went over this. I did have to step out a few times. If I go to my regular doctor for standard blood work to check, diabetes or blood, yada, yada, for whatever they check in the basics, will kidney issues show up in that blood work, or is there something special that I need to ask for to make sure that as a whole food plant-based eater who only recently went SOS free should be, concerned about to check annually or, something? Thanks.
Yeah, it's a good question. The things you want to have checked are creatinine in the blood work. Creatinine is often checked in a basic metabolic panel, also known as a BM, as in Mike, a P, BMP. And so you can get your kidney function checked that way. So that will check the kidney function as it relates to the filtration aspect in the blood. But because kidneys also make urine, you also want to take a look at the urine. The 2 things I recommend to have tested in the urine is this called a UA, or urine analysis. And then the last thing is just something to look at whether you're losing too much protein in your urine. And so you want to check the albumin in your urine. It's called a microalbumin test. And that tests those 3 things: a BMP, a UA, and a microalbumin test. Usually round out the things that I would do to screen someone for kidney disease, like someone who has risk factors for kidney disease like diabetes or high blood pressure or family history. In other cases, I might get a kidney ultrasound, but I think doing those first 3 things is reasonable just to make sure.
Excellent. Thank you, Dr. Joshi. And up next, we have Lorraine. Hi, Lorraine.
Hi. Thank you so much for your speech. I have a question about water. I'm going on a safari for 9 days, they have bottled water. I know what happens to bottled water when it's in the sun. I'm happen to be at Whole Foods Market right now. Are there any alternatives that I could bring with me that's not too heavy to substitute the water in the plastic containers?
Well, water, well, you want to drink water. There isn't really a way to get around drinking water. Even if you drank tea or soda or juice, a lot of that is mostly composed of water. So you definitely need the water. If you're going in a situation like a safari or someplace where you're going to lose a lot of fluid through sweating and insensible losses from respiration and breathing, you definitely want to replace that with water. I understand your concern about water coming in contact with plastic and the potential for the plastic leaching into the water. You could use reusable containers like a canteen or a bunch of canteens. You could keep the water outside of the heat or just cover it with a blanket to minimize those things. But I think this is a situation where you may not be able to get around the water. There's no way to minimize water. It's one of those substances that cannot be compressed because of the way it's structured.
Thanks very much for that. And David A is back. Hey, David A.
Hi, I had a follow-up question. It concerns when you have kidney stones and treating it. I heard that an alternative to surgery is sound waves. I was curious to know your thoughts about sound waves, when they're useful, when they're not useful versus surgery, and how effective they are.
Yeah, so that's a good question. I don't know the nuances of it. Usually at that point, I hand it over to my urology colleagues. There is a way to break down stones through extracorporeal shockwave lithotripsy, which is a long tongue twister of a phrase that basically means that they're using sound waves outside of the body to be transmitted into the body to break down kidney stones that are in the kidney. And that has been used. My understanding is that if the stones are too big or too hard, this may not work. So it doesn't always work, but it can be an option for some people. Who those people are beyond the scope of what I know, is I don't routinely do this procedure myself. The urologist would do it. So for someone in this situation, seeing the urologist and asking that question is reasonable. There are other ways to break kidney stones, using lasers, surgery, take them out. Sometimes with medication, they can dissolve. I recently had a lady who had some smaller stones, and she was able to dissolve it on her own using a combination of medications and changes in her diet. And now she's off those medications. The potassium citrate is just doing fruits and vegetables in her diet, minimizing her animal protein, and of course, increasing the water intake and minimizing the salt.
Excellent. Thank you very much for that. And up next, we have somebody with the initials MB. Welcome. Oh, hang on. Let me unmute you. Sorry about that. MB, I'm going to unmute you, so I'm not sure if you're pressing your button.
Oh, okay. Great. Thank you very much.
Hi, welcome.
Hi, it's Mary. Thank you, doctor. That was really wonderful. I'm wondering if you have any advice on maybe some simple, poignant thing to say to someone. I know someone casually who's dealing with kidney disease from having a cancer diagnosis, and I guess the treatments there have depleted his kidneys. He's waiting for a transplant. I don't think he's doing too well. And, trying to, I know a few other people too, but trying to open them up to whole food plant-based eating is maybe another solution to help in their health journey. Maybe also referring them to someone like you, but, what can we say to someone that, because I've had people say like, oh, the potassium thing, can't do that because of the potassium. But something maybe, poignant and simple to say to people to maybe have them look at this as an option to help them in their health journey.
Yeah, so I think there's a lot of considerations, a lot of things to take into account in this situation, the type of chemotherapy that was used, the state of kidney function before, state of kidney function now, any complications from the kidneys. Do they have high blood pressure, diabetes? All these things play into account and coming into a detailed management plan, which could be created by a nephrologist, which is recommended in this situation. But in general, a lot of things that I spoke about on this topic, eating for your health, is pertains to eating for your kidney. The foods that are healthy for your body are also healthy for your kidney, and a lot of those foods are plant foods. And you could avoid potential damage by eating a plant-based diet. You prevent gaining weight. You can prevent developing diabetes, prevent high blood pressure. If you have these conditions, you can certainly mitigate the severity of it or perhaps improve it. And all these things have downstream consequences on the kidney in a beneficial way. And then also eating a plant-based diet also has the beneficial effect of treating some of the direct aspects of kidney disease and the complications of it. It's by no means a miracle cure, but it's definitely, something to think about. It's like diabetes. You could either eat sugar all day and, inject yourself with insulin, or you could cut back on the sugar and eat a whole food plant-based diet and then require a whole lot less insulin, if any insulin, by eating a healthier diet. It's the same way with kidney disease. You can make something that's bad worse, or you could use diet to your advantage and protect the kidney and help it last longer, hopefully for the duration of a very long life.
Thanks very much, Doctor. Excuse me. And let's bring in Chris now. Hi, Chris.
Hey, how are you? Thank you so much for excellent presentation. I just wondered if you had any advice or whatever. I do have hypercalciuria, and I do take in 2.5 indapamide a day to kind of keep that under control. But my 24-hour urines that I had showed I've been trying to do a plant-based now for like probably the last year, that I was pretty high in my oxalates in the urine. So I know you gave 6 things. I was eating spinach, which I now do not eat, but because I realized now that it was bad. But any advice you can give to me? I haven't had a oxalate stone. I did have a calcium stone 20 years ago, but I don't, I haven't had any since. But whatever advice you can give somebody with hypercalciuria and high oxalates.
Yeah, this is actually really tricky because this is like trying to diffuse a time bomb or walk a tightrope wire. Because if I pick the wrong wire, or I tell you to do something and I don't have all the information correctly, I may inadvertently tell you something that's adverse to your health. This is one of those situations where knowing all the details precisely is very helpful. From what you've described, it sounds like you have a combination of both having high calcium and oxalate in your urine, and that's the reason why you're on the thiazide diuretics. So it sounds like, so this is where it gets tricky, is that if you have a lot of oxalate in your urine, sometimes the treatment for that is calcium, to take in more calcium, but that could be a problem if you already have a lot of calcium in your urine, which it sounds like that is your problem. So for me, I would like to know pretty much all the details of what's going on in your diet, what's going on in your blood, what's going on in your urine, to see what levers I can modify to help reduce the oxalate and calcium in your urine, ultimately prevent you from having a stone. Where it gets tricky is that most stones are a combination of calcium and oxalate. So to have not a calcium stone, but to have an oxalate stone, it's getting a little confusing. So I can't really say in detail because you're kind of the exception to the rule. Many people just have a calcium oxalate stone, and it's usually because they didn't drink water, they ate too much animal protein, they had too much salt, as in my own case 20 years ago. But you are the exception to the rule, and certainly are someone who should see a nephrologist to get a very detailed recommendation on what to do. Or you're welcome to see me. I'm licensed in the state of New York. So that's something you can email me about if you wanted to see me.
Thanks very much, Doctor. We're out of time, but I have one question left. So I'm going to squeeze in Kathy. If you could do this real quickly, Kathy, thank you.
Oh, thank you. So if you, before you can go to a kidney doctor, you have to know that you have a problem with your kidney. What are the top signs that you have a kidney problem? Or is it something that's just, you go to your primary care physician and they do a lab test and they say, oh, you got a kidney problem?
Yeah, you could. Yeah, it's usually detected by blood work, blood or urine testing, or some people have an abnormality of their kidney detected on ultrasound or CT scan. So the tests that you want to do are the ones that I mentioned earlier. You want to get that BMP, a UA, and a microalbumin test. usually those things, if all three of those things come back, normally you probably don't have a kidney problem. But way you know about it is by asking your primary care doctor, getting checked. Those are the most common ways.
Thank you for that last question, Dr. Joshi. And thank you for, again, just an amazing presentation. It's meant so much to so many of us. Your pioneering work is a stand for all of us. So thank you. I'm not the only one that wants to thank you. I know this. So I'm going to ask our tech team to unmute our entire audience. What does everybody want to say to Dr. Joshi?